Recent attention has been raised about surveys of patients after hospitalization and their measure of patient experience. I know a lot of physicians have been asking themselves, why do the answers to a dumb survey matter if I know my patient is getting good care? This is just a bunch of business people telling me how to practice medicine. Well, first off, there is mounting evidence that suggests that patient experience is linked to better outcomes. This study of 6 surgical procedures at 3,000 hospitals found that higher patient experience scores were associated with shorter length of stay, lower readmission rate, and lower mortality. Similarly, this study of CMS data from nearly 4,000 hospital medical patients found higher HCAHPS scores correlated with higher Yelp score and with lower mortality and readmission rates. Another reason is that our evolving healthcare system, with its emphasis on value, will increasingly be financially rewarding those institutions with better patient experience. In addition, good patient experience becomes increasingly important in our community with growing competition. Data clearly shows that patients go to hospitals that are convenient and where they feel they are respected and cared for. This means that patient experience is an essential part of hospital strategy going forward. In my opinion, the most important reason to focus on this issue is that aside from making the right diagnosis and giving the correct treatment, it is our job as physicians to help transform the difficult experience of having a sick child into something as positive as possible. So how does the physician community improve our patient experiences? Well, in addition to improving our access to care and our care processes, better communication with our families and other physicians would go a long way towards addressing this problem. A national consultant called the Studer Group has come up with some tools to help with communication with families. ADET is an acronym that encompasses the essential parts to better communication with patients. The doctor establishes a welcoming attitude right off the bat and greets each of the family members, and then introduces himself or herself with some background. The D and the E of the acronym refer to the importance of telling the patients an accurate timeline for their care, even if it is prolonged, as well as exactly what is going to happen to them. Frequently, the patient's anxiety level in the emergency room or hospital is around when things will happen and its impact on the other things occurring in their lives. Thanking the patient tells them that you appreciate them coming to see you rather than the old school attitude that intimated that the doctor is doing the patient a favor by taking care of them. Another important tool is managing up. Too often healthcare workers throw each other under the bus in front of a patient when things don't go exactly as planned. Being a healthcare team means working with nurses and other doctors and supporting each other. Aside from these tools, it is clear from patient comments that we can do a better job of coordinating our care for patients, and that means rounding with bedside nurses, coordinating multidisciplinary rounds where appropriate and possible, and getting on the same page with our consultants. The mixed messages that consultants and primary teams give is confusing to parents. The whole point of all these measures is to provide good care that is coordinated and that lowers the anxiety of the patient and the family to make their visit more positive. To illustrate some of these points, the following is a series of video clips showing 2 approaches to patient communication and teamwork. In each pair, Hospital X is a struggling hospital, and Hospital Y is learning to incorporate some of these tools. Where do you think the best place to work would be?
How are you guys doing? I'm with surgery. I hear you have some belly pain, some appendicitis.
Hurts right here.
Let me see.
Ow.
Okay, Mom. So we're going to take him to the OR. We're going to take out his appendix, okay? I've done these a lot, okay? You don't have to worry about anything. We should probably get him down to the OR the next few hours. I'll have to talk to my nurse, okay?
I'm sorry, who are you?
My name's Trevor. I'm with surgery. I'm one of the doctors.
Okay. And
Okay.
how do you know for sure he has appendicitis? You just touched his belly.
Well, I talked to the ER doctors. They told me that they did some scans and that it looked
Okay.
like he had appendicitis.
So
I
they
just
didn't
came
tell
in.
me those results. So he does
Okay.
have appendicitis.
He does, yes.
Okay.
Yeah, and we'll get him taken to the OR.
And you have done this how many times?
I've done it over 100 times.
And what are the risks for
I mean, there's bleeding, infection, you can cause perforation of the bowel.
perforation?
But don't worry, I've done this plenty of times. Plenty of times. You don't have to worry about it.
So what time are we going to do this? I need to call his dad.
I probably have to talk to my nurse. It might be maybe in an hour or two.
An hour or two?
Okay.
He's in a lot of pain. Is there something we can get him for pain?
Yeah, we can. I'll talk to the ER. We'll get him some pain medicine.
And
Okay.
how long do you think we'll be in the hospital?
Maybe a day or two.
Okay,
Okay.
a day or two?
Yeah.
All right, and so what's going to happen? What's the process? We'll be here for an hour or two,
You'll be here. We're gonna wheel you down to the pre-op, and we'll go to the OR, and then after OR, we'll get him out and we'll get him up to the floor.
Okay,
Okay.
and is he on any medicines while he's here?
Yeah, we'll start on some pain medicines.
And what are the risks for anesthesia? He's never had anesthesia before.
He's never had it before.
No.
Okay. I mean, there's risk to any type of medicine, but I'll have the anesthesiologist come in and talk to you about it. Okay. Okay?
Okay,
Okay, any other questions?
I don't think so.
No? Okay. All right, so we'll get you down to the OR, okay?
Okay, if I come in?
Yeah, go ahead.
Hey, how are you? My name's Dr. Meyer from Pediatric Surgery. How are you doing? I'm the pediatric surgeon. How are you?
Joey.
Hey, Joey. Nice to meet you. I heard that you've not been feeling well at all.
Yeah.
And you come to the right place. Got a lot of experience here. We do take care of a lot of kids with the issues that it sounds like you've had, which is appendicitis, from what I understand from Dr. Higginbotham here in the ER. He told me that that's what you have. And so you've been having pain for a few days, is that right?
Yeah, it hurts a lot right here.
Right there on that right side? Okay. Is it okay if I examine him, Mom?
Yeah, sure. So this is the first time we've heard he does have appendicitis?
He does have appendicitis, and this is a really common problem, appendicitis, and we see about 700 cases a year. We've got a lot of experience in it, and so he's going to be just fine. He's going to be really good. Okay, can you just straighten out there for me 1 second, Joey? Good job. Does that hurt at all there?
A little bit.
Okay, how about right there?
Yeah, that hurts a lot.
All right, that's good. All right, buddy. How about in the back there? That's okay. All right. Well, that's good. So, Mom, you know, appendicitis is a problem that's very, very common in kids Joey's age, and the treatment is to take out the appendix. So we're going to do this surgery in the operating room downstairs, and it will probably be able to go to surgery in about an hour and a half. So you guys will be here for that first hour, and then you'll go down to surgery. And anesthesia will talk to you down there about the anesthesia. They're very experienced. They're great docs, have a ton of experience with kids. And the surgery's done with a scope. We put a little scope in, a couple of little instruments, and I'll take some pictures and show you afterwards what it looked like.
Okay.
After surgery, he's going to go to the recovery room where he'll wake up, and you'll be able to visit him there. And then after that, he's going to go up to the floor and probably be able to go home tomorrow.
Okay. He's in a lot of pain. Is he able to get some pain medicine?
Absolutely. We can give him pain medicine right now. We're going to give him a little bit of fluid. We're going to give him some antibiotics.
Okay, good.
And after surgery, when he's got a little pain at those little incisions, we're going to give him all the pain medicine he needs to make him comfortable. There's no need for him to not be comfortable here in the hospital.
Okay.
Okay. Joey, do you have any questions for me?
Will I be able to eat my Thanksgiving dinner?
You can eat like a pig post-op, whatever you want.
Great.
All right? All right. Well, nice to meet you guys. Thanks so much for
Thank you
coming
so
to
much.
Thank you
Dell
so
Children's,
much.
and I'll see you downstairs.
Okay, thank you.
Okay? You bet.
All right, Miss Smith. So we just got him out of the OR. It was appendicitis, just like we thought it was. Should be getting him out of here soon. Okay, so you'll be able to see him.
Okay,
Okay?
so about how long before I get to see him?
Maybe an hour or so.
Okay.
I'll go talk to the nurse.
And what kind of pain medicine is he gonna get?
I'll talk to the nurse as well. We'll get him some pain medicine. Okay.
Any more antibiotics?
No, shouldn't need any more.
Okay.
You'll talk to the nurse. You'll hear all this from her.
What can he eat when he wakes up?
He can eat anything he wants.
And about how long do you think we're gonna be here?
Maybe a day, maybe 2 days.
What about like bandages? Is he gonna have bandages on his stomach?
Yeah, he will, but the nurse will talk to you about that.
Okay. When can he go back to sports, to school?
Sports maybe in a week, 2 weeks, but we should see you later, okay?
Okay. Do you want to see him back?
Yeah, we'll see him back a
Okay.
little bit later.
Are you gonna come back and see
You'll talk
us
to the
like
nurse.
post-op?
Yeah, I'll be back maybe sometime tonight or tomorrow, okay? But I have another case I have to get to,
Okay.
okay? All right.
Yeah, sure.
Hey, Miss Smith, everything went really well. Joey did terrific with the surgery, so it's just like the scans showed. So, right now he's in recovery room, and in about 20 or 30 minutes, you're going to be able to go back and visit with him.
Okay.
And then he'll go up to a floor in the room, a room on the floor where he'll get lots of pain medicine. The nurses have been given a bunch of orders for pain medicine, so he really should not have a ton of pain tonight. That
Okay.
should really be covered. He can eat whatever he wants, and there are no restrictions on diet. He's going to have 3 little dressings on his tummy, and those sometimes get a little drainage on them, and that's normal. We put numbing medicine around the incisions to help with the post-op pain, and it leaks sometimes a little blood onto the dressing, so don't be worried about that. And then he can start walking around tomorrow, and I'd like him really walking and moving to help with his help with his lung function and that kind of thing post-op. So the nurses will be helping getting him up out of bed and moving around. Activity-wise, he really, he's got about 2 weeks of no strenuous activity.
Okay.
But he could go back to school in a couple of days, like we talked around upstairs.
Okay.
And, he can shower starting tomorrow, and I will want to see him back in follow-up. But I'm going to see you tomorrow morning because I'll be around checking in on him as well. And I've got some really good nurses upstairs who are going to help, who've taken care of a ton of kids with appendicitis. They really know their job, and they'll be taking care of them as well. So what questions do you have for me?
Is he awake right now?
He's real groggy,
Okay.
but he'll be waking up here in the next 20, 30 minutes. And once he's awake enough to know what's going on, they'll get you back to see you.
Okay, good.
So we're going to give him.
Oh
So.
my gosh, thank you
You're good,
so much. It was a
Absolutely.
pleasure meeting you.
Well, thanks so much for coming to Dell, and we'll see you later.
Okay.
If you come on out to this waiting area out here,
Okay.
you can wait out there until it's time for you to
Perfect.
go back to the recovery room.
Okay, that sounds really good.
All right.
Thanks.
Great. Let me show you the way.
Okay.
Hey, I'm a resident. I heard you guys got admitted from the ER for some belly pain, something like that. Does that sound right? Okay. All right. Well, so we're gonna keep an eye on you tonight. Sounds like we've got a GI doctor coming and seeing you in the morning. I don't really know what's going on right now. I have to go talk to my attending about kind of what we're gonna be doing. But other than that, that's kind of what's going on right now.
Okay, I'm sorry, what is your name again?
Oh, sorry, I'm Dr. Gilbreth.
Okay.
I'm one of the residents.
Just a resident.
Okay.
Yeah.
Now, he's been having this severe abdominal pain for 2 weeks. We have seen his pediatrician 3 times, and I feel like we are here, and I want something done, not just, hey, I'll see you later.
Yeah, no. That's why you guys are here, right? We're going to take care of you. We're going to figure out what's going on. Obviously, we've got to do a bunch of tests and things like that, but after we do all of those, hopefully we'll have an idea, right?
So what test do you plan on doing?
I need to look at what they did in the ER. I don't even know what quite. I haven't looked over his chart quite yet, but we'll do that. I'll talk to my attending. We'll come up with a good plan for you.
Okay, he's been having lots of pain. Is there any medicine you can give
Yeah.
him?
We've got pain medicine. We've
Okay.
got plenty of pain medicine.
Do you know when he can have some?
I don't know. I think he got some in the emergency department. I'll look at when that was, see if I can give him some more now.
Can he eat?
I would say not right now. I need to figure out what's going on.
All right, because he hasn't eaten in 3 days.
Yeah. Okay. Yeah. We'll make sure we help him with that.
How long do you think that we'll be here?
I don't know right now. Again, I'm just getting to know you, but we'll have a better plan. Hopefully, maybe later tonight sometime.
Okay, so what do you know?
I know that you got some belly pain. I know that you're here to get help from us, and we're gonna do our best to help you.
Okay, do you have a supervisor or something?
Yeah, I've got an attending. I have to go talk to my attending and come back.
Okay.
Okay.
That would be great.
Yeah, absolutely.
Okay.
All right.
Alright, well, let's go ahead and finish what we were doing, okay? Alright, just gonna go ahead and get your temperature. Open your mouth for me.
Hello, I'm Dr. Iyer. I'm one of the attending physicians, and this is Peter Gilbert,
Gilbert.
one of my
Very nice to
residents.
meet you
Nice to
guys.
meet you too.
We're just gonna let Katie do what she's doing and then start asking all some questions.
Okay.
Okay? So Peter and I, we looked at the emergency room records, we talked to the ED physician. So from what I understand, you've been having some pain for the last 2 weeks. You've gone to your pediatrician, they've given you some pain medicines, they've done an x-ray, some stool studies. Nothing has helped, am I right?
Yes.
Okay, and you've been not able to eat anything for the last 3 weeks,
Right.
right? And also in the emergency room, they did give you some pain medicines and that kind of help and didn't help you,
Just a little.
just a little. Anything else that we need to know, Mom, that we missed?
He's had like about 15 pounds of weight loss in the last 2 months, and he's been having like diarrhea off and on. And he said he's seen blood in his diarrhea, but I haven't seen any blood yet. So I'm really worried about him because he's lost so much weight, he hasn't been eating, he's having this pain, and no one's been able to figure out what's going on with him.
So we're going to start with some pain medications, initially a mild one like Tylenol or Motrin, but we're going to do it around the clock so he gets it even if he has no pain. And then if the Tylenol and Motrin is still not controlling your pain, we may give you something stronger, okay? Katie's your nurse, you can call anytime, we both are here all the time, you can call us anytime you have questions. So I'm going to go and examine you, look at your chart once more, and most likely we'll have a gastroenterologist.
Mhm.
So from looking at you and listening to your question, definitely you're not going home today. You'll have to stay with us today. I would say for the next couple of days, you'll have to be in-house, figure out what's going on. We need to make sure he's able to gain some weight, eat, and be stable before you can go home. Okay, and that should be okay. And your pediatrician, we will be calling your pediatrician and letting them know everything that's going on in the hospital, so they are aware of what's happening here.
What do you think's going on with him?
Most likely looks like an infectious reason, but Peter and I will come back and talk to him a little more alone by himself to see
Okay.
if he's what this weight loss and anything else is happening.
Okay, I think that sounds really good.
Okay, thank you.
Thank you.
Hi, how's everyone doing?
All right. Good.
So what's been going on again?
I'm sorry, who are you?
I'm sorry, I'm one of the doctors, the residents in training here.
Okay.
So it's nice to meet you.
What is your name?
I'm Dr. Anand.
Okay.
Yeah, nice to meet you guys. Is there anything I can help you guys with today?
With what? We've been here for 2 days with abdominal pain.
Okay.
We saw the GI doctor yesterday, but I wasn't really here to kind of find out the results.
Oh, okay.
Do you know when the GI doctor's gonna be back?
No, I don't actually know. I'm sorry, my list is just, blowing up right now, so I haven't really heard from GI at this point. I don't really have much to tell you right now.
So no plan about what's going on, why she's losing weight, why her belly's been hurting?
Yeah, at this point, we'll just wait and see what they say. Hopefully they'll come see soon and, we'll have an answer of kind of what's going on. So
We've been
sorry.
here for 3 days now.
Excuse me for 1 second. I'm so sorry. I'm sorry. I'll be back in a little bit. Hopefully we have an answer by then, and then we can kind of address what's going on. Okay. All right. Are there any other questions right now?
Do you have a supervisor or something? We've been here for 3 days.
I understand. I'm so sorry. We've just been so busy lately, but
Well, I think that's unacceptable. I mean, the GI doctor came, I missed him, I haven't heard what's going on.
yeah.
This is totally unacceptable.
Oh, hi, sorry, I didn't realize you were grounding.
Oh, yeah, I just came in really quickly to kind of update parents, but I actually have to leave right now to see another patient, so I'll be back in a little bit, okay?
Oh, okay.
Okay, all right.
Are you hurting at all? Do you need anything? What would you like?
Katie, we're going in to see room 3 or 4. Do you want to come with us?
Oh, okay, yeah, sure.
Is it okay if you all come in with the team in?
Yeah, that'd be perfect.
Hi, I'm Dr. Aya. I'm a pediatric attending physician.
Nice to see you.
Nice meeting you. This is Trevor, my senior resident.
Nice to
It's
see you.
Rena,
Hi.
and
Hi.
Katie, a nurse.
Good to see you guys.
So we had some conversations with Dr. Zena, GI doctor, and Trevor is going to give us an update and next steps of what we're going to do today.
Okay.
So how are you guys doing today?
Overall, today was a pretty good day.
Okay, good. So like Dr. Iyer just said, right before we came in, we spoke with Dr. Zwiener. He's the GI doctor. He's been working here for I think about 20 years. So he's very experienced. We talked to him about what's going on, and he has some concerns because you've had some bloody diarrhea for a few weeks now. But because you're having this bloody diarrhea, we need to kind of take a look to see what is actually causing this. And in order to do that, we have to do an endoscopy and a colonoscopy, which is essentially taking a camera from up above through your mouth and then a camera from down below. Okay, you're going to be completely asleep throughout this whole process. And the reason why he wants to do that is because then he can see what's going on inside. Okay, do you guys have any other questions?
I can't think of any, can you?
No? So if you're having any concerns, any questions, just give any one of us a call or let Katie know and then she'll give us a call, okay?
I think that sounds good.
All right.
All right, thank you so much. Very nice to see you.
Thank you. Nice to meet you.
Thank you.